what I'm going to be speaking today is certain aesthetic adjuvants to all the disease, defects and injuries to our facial structure. So because maxillofacial surgery also kind of have this aesthetic adjuvants which I'm going to be speaking about. Facelift is in a different class altogether. It's like it's like way above. So we can all start, if you are not into aesthetic practice, you can all start with simpler aesthetic procedures which are very simple. So what I'm going to be doing is, in a short period of time, what I'm going to show you is a few videos which are going to help you in kind of doing certain aesthetic adjuvant procedures. Okay, so simplest procedure which you can do it under local anesthesia is your buccal fat pad removal. How many of you do buccal fat pad removal? Please hands up. Monica, 1, 2, 3, 4, 5. Why others are not doing it? It's a very beautiful procedure. You can combine it with macetotoxin if you want to do non-surgical procedures. Somebody who has got a chubby cheek, or not chubby cheek, somebody who has got a very squarish kind of a face, you can combine macetobotox with buccal fat removal, and in 3 weeks time you're going to see her face slim down. Superb. So what I'm going to do is I'm going to show you how to access your buccal fat. Very simple procedure. All you have to do is just get to the Stensen's duct, see where it is, about a couple of centimeter, and boom, you are there. You are there. All you have to do is go through the buccinator and you are there. So all you have to do is, yesterday somebody was talking about the extensions of the buccal fat. You have the buccal, you have the temporal and all those things. All you have to do is just see how much amount of buccal fat is just popping out is all that you have to remove. That's it. Don't keep on pulling out. All you have to do is just tease through the capsule and you see the buccal fat coming out. Very important is you have to cauterize that buccal fat before you just, don't cut it off because it's going to bleed very bad.
How far away from that duct?
Wherever you want. No, because you are staying down, so and your direction is going to be distally.
Yes, you say that.
Sorry. So your incision is, see, this is the duct, you know the duct, and you just put an incision wherever you want to at the 6-7 area, and you just put your, go through the buccinator area, you're there. It's very simple. So all you have to do is, and then suture it off. That's it. Very simple procedure. Yes, no? Yes. So somebody comes to you with a square face, what will you do, guys? Macetobotox and? So what will macetobotox do?
Slimming of the ankle.
Huh?
Slimming
of the face. So what it is going to do is, it is going to kind of pachkofy your masseter, and this you removed it and it is done. Chale aage. Next procedure. Huh? Sorry? Any questions? No. Okay. Okay. Another very simple procedure, dimpleplasty. One of my favorite procedures. All you have to do is get the patient in. मैं तुम्हारे को which actress has got a beautiful dimple? Everybody wants to look like Priti Zinta. Now what I am going to be showing you and explaining here is how do you make a dimple in a very simple way. I have designed this the whole procedure, and it's going to be a very simple procedure, just a cakewalk. Just try and understand what you're doing in a dimpleplasty is basically, see, original dimples, a natural dimple is actually created because the zygomaticus major muscle which comes here, it becomes bifid. So one part of the bifid, it goes into the skin. The other part goes into the modulus. So what happens is, every time the patient smiles, not the patient, the beautiful lady smiles, she has a dimple. So this is called as a dynamic dimple. Dynamic dimple is basically, you see the dimple when the smile is there. So you don't want a static dimple, you want a dynamic dimple. But you can't do this. You can't make the zygomaticus major bifid and you can't insert it. So all you're doing is now creating a scar. All you're doing is creating a scar from the dermis to your mucosa or the muscle. Actually, it is the buccinator muscle you are going to be creating. How many of you do dimple? How many of you do dimple? 1, 2. That's it.
Who's dimple here?
Who has got a dimple here? See. So it's a very simple procedure. You can do it in your OPD procedure. The patient is very, very, very happy.
So it will make money and everybody will start doing it.
Makes money instant. Half an hour and you have whatever it is. So what I'm going to be doing here, now I'll explain you the procedure. There are a lot of methods in which in the literature it is there. So you have to go underneath, take a bite from the dermis and things like that. I'll tell you in a very simple way. I am just waiting for my 30 cases and then I'll publish this. Huh? What? Wait. So the first thing is you mark. Where do you mark? Again, lateral canthus, drop a line, and this can be along the corner of the mouth or on the cupid's bow, wherever it is. So you can mark. Most important, the dimple should not be 1 point. It should be long. Then only it's going to look nicer. So you extend it. Put a line about a centimeter. Okay. Now give anesthesia. Okay, that's the anesthesia local you are giving from outside. And now what you do is, you're going to be passing 2 needles from outside, which is going to go inside towards the mucosa. Again, how do you access this is basically, you put 2 needles from outside and this is what you're going to be seeing, the 2 needles, and all you have to do is join this. Only the mucosa. What you will do is just mucosa. Now take your scissor and go through buccinator, and you reach your, put your finger here outside on the epidermis. Don't go through the dermis. All you have to do is you should feel. Okay, now just come back. You understood this? Take that scissor, go through this, open it up through the buccinator, through whatever structures you are reaching your dermis. So you will feel that kind of scissor there. So keep on opening it. You should feel that in your on a thumb. So keep on opening that, and you have reached your dermis. All right. You have now reached the dermis. Now what do you do? Now what you do is just pass a needle, 18G needle through the lower part, and you pass your suture there, and the same thing you do ulta. And now what you have done is basically you have come through out both the parts of the suture. Guys,
Yes.
sleepy.
No.
Show it again. Oh, you play it.
I'll tell you why I'm putting the skin incision.
Yeah.
Just go back. Okay, so now what I have done is okay, now the first thing what you will do is take a proline, take a bite from your mucosa. Got it? The first step. Take a bite from your mucosa and the muscle. Buccinator.
It's the same guy again, huh?
No, ma'am, I'm weak.
CPS को wake him up.
Today I can't run.
किसी और को लगा दो, रोहित सर को लगा दो भगाने के लिए.
Who was the one sleeping?
Okay. So the first thing what you will do is you will take a bite of proline and go through the mucosa and the muscle, right? You have taken the bite there. So now how do you come to the outside? So what you do is take a 18G needle, pass through the lower point here and come out. Okay. So if you see here, I don't know.
तुम्हारा डिंपल बहुत जोर से भाग रहा है.
बहुत ज़्यादा स्पीड ज़्यादा कर दिया है मैंने. Okay, so now this is what it is. So I've taken the bite. फिर निकल गया. Anyway, you understood, right? The needle goes, the 18G needle. All you have to do is take that suture ka needle and you just push it into that and just pull it outside. So the whole needle is outside. Okay. So this has come out here from this side. Okay. Now what you do is again pass the 18G needle from inside and just go out to this thing. अरे भाग गया आगे. Okay. So now. So this is gone and you have passed the needle and you pull it out. Okay. So the whole thread is inside with a small, kind of a cuff here. Okay. Which is holding on to the epidermis. Now the most important thing. Okay. So now what you do is you suture it up here. Just before suturing, what you do is just put your incision, just score the epidermis. That's it. You are not supposed to be scoring the dermis because you want to create a scar from the dermis to the inner buccinator muscle. So all you have to do is just score the epidermis and then suture it up. Okay, so what I am doing here is just scoring the finished, and all you have to do is just suture it up there. So you can, no, so now this is very important. So now what will happen is basically it should be static, and it is going to be static now. So over a period of 3 or 4 weeks, what happens is this static dimple is going to become a dynamic dimple. So this is what you have to tell your patients. This static dimple is going to become dynamic in 4 to 5 weeks time. Then it is going to look nice. But first, when the patient says, "Ek gadda pad gaya hai," it's absolutely fine. You can do unilateral, you can do bilateral, you can do whatever you want.
Button, what about the role of the button?
Which outside, it heals epidermal.
No, but you've not put a button. Would you advise putting a button outside?
Button.
Button.
No, nothing. Nothing. Just soframycin ointment, that's good enough. That's okay. Now this is very important. Don't remove it in 7 days time. So you have to create a scarring. At least 3 weeks time is what you have to leave. So your proline can be left shorter. Bolo.
Sir, if your patient after 3 weeks it says, "No, I don't like this dimple, I want to change it."
Very difficult.
It becomes pimple.
Okay. Next surgical adjuvant. Next surgical aesthetic adjuvant.
Next, yeah.
Okay. Somebody said like we do a lot of. So I want to augment my chin. What do we do, guys? What do you want to do if you want to augment your chin? Genioplasty. That's it.
Silicone implant.
Yeah. Fillers will not even one syringe. साला 15,000 17,000 का पैसा हमको कुछ मिलता नहीं. You don't get anything. You do, and that 6 months it disappears, and you're not able to actually give that kind of results. So, if you want to augment your chin, this, however you want to do, the best thing to do is not best. I wouldn't say that, but simplest way probably would be a silicone implant. Very simple thing. You take the implant, it's silicone. Cut it however you want, put it here and put 2 screws. Finished. आपको क्या लगता है किधर डालना चाहिए? Okay, so I want to augment it. Put the incision there, little towards the labial side, and access the chin area however you want to do your genioplasty. Very simple. Go through it and go to the periosteum. Now you're going through the periosteum. You go and dissect. All you have to do is go almost toward the lower border. Very simple. Very simple, because all of you are used to kind of doing trauma. All you have to do is just expose it. Okay, so I've exposed it. Now you have the implant in your hand. There are various sizes of implants which are available. So they're very simple procedures. You can do it under local anesthesia also and earn some amount of money. Okay, so this is how your implant looks like. Okay, so what you can do is this implant, you can always trim it up. So you can trim however you want to. You can cut, you can shape it up however you want to do, whatever you want to do. The advantage of doing an implant is basically that if the patient doesn't like this, sir, Abhay sir ne bola, the patient doesn't like, no problem, come back, I'll remove it. Just put it there. Just remove it there, charge some money for removing, that's it. Put 2 screws there, that's it. 1 screw gone and 2 screws gone. So now maybe we should discuss this. Should I be putting the screw or not? What do you feel, guys? Should I be putting a screw or not? Why shouldn't we leave it like that? It's a pocket. So movement can cause resorption of the bone. That is one very important thing. And then close it up. Right?
Very simple.
Very simple.
Simpler than incision.
Huh?
If I use an extraoral incision, which I do. First of all, I don't use the intraoral incision.
First of all, for this implant we discussed about it that day also. I never use an intraoral incision for placing this. A small submental incision, what I usually use for this kind of a chin implant. Why? Because these implants are bound to get infected. The oral cavity getting an exposure, there are chances of communication. Maybe your sutures open up. Something can happen. But an extraoral incision.
Sir, can you give me the phone, please? Sir, can you give me the phone, please? Yeah, go ahead.
An extraoral incision, your tissue dissection is very easy. So you can actually just leave the implant in, and you can actually you don't need to even put a couple of screws there. You can actually suture this to the muscle and leave it there, because it is going to fit snugly, and it is going to be like that. But if you're using an intraoral incision, then you have to put in screws.
What I personally feel is, obviously everybody has their own way of doing it. Yeah. ठीक है, वो उसके लिए छोड़ देते हैं, वहाँ डिस्कस करेंगे, ठीक है। ये पॉइंट उठाना, हाँ बात करो। ये मैं एक्चुअली ये आर्टिकल खोल के बैठा था, मैंने आत्रिया को भेजा था, मैं खोल के बैठा था, मैं पढ़ने वाला था, मैं जाने दो इसको, ठीक है। Okay, we'll discuss about it in that. Okay, next thing. He showed one picture like a patient is gone, like cheek area is gone, sunken in. What do you do there? Fat grafting. There she has. So now what do? I do a cheek implant. Put implant wherever you want. Wherever you want. Male patients come, you want to make them female, put an implant. Very simple. No, we do a lot. Almost 6 to 7 cases we do in a month. 6 to 7 in a month. That's not big. So again, same kind of incision. Expose that area, whatever you want to, wherever you want to put. I think this is, for a maxillofacial surgeon, it is left hand job. You can just...
So putting a silicone implant, is it necessary to completely open it? Can't you just create a pouch and push it over to the...
So you should not leave it unscrewed. It should be fixed. So there is a lot of discussions going on, fixated or non-fixated. It's always better to fix it. What's the problem? Why can't we fix it? Very simple. 2 screws and we are done. There. You can, kind of cut and shape and however you want to. There are different sizes, there are different shapes. I've done plenty of this and I feel that we should fix it. It's not a very difficult job and we can just go ahead. 2 screws again.
And how about the tissue glues?
Tissue
glue?
I have never used it. I really don't know when I can put this, fix it up, all. What's the problem? No, I have not.
Arun.
Yeah. Okay.
We have time for questions later.
Okay, so the same thing you're going to be doing on the other side. Okay, so this is how you're going to be cutting it. So all you have to do is, this is how the implant would come. Okay, this is how it is, and okay, whatever it is. So earlier days we used to use Medpore and Biopore, but I used to have a lot of rejections and infections and things like that. Okay. Now another thing which I want to do is submental liposuction, which Dr. Athriya was just mentioning. So a patient comes to you, she has a double chin, she complains of double chin. Okay, so we know about superficial fascia, so that is enclosing the platysma. So now what we are going to be doing is removing some extra fat which is there in the neck. This part which is between the platysma, you actually have to put the incision and you have to hold it and you have to take it out. But there are a lot of fat which is there which you can take out without opening up. Simple procedure, and then you can actually define the jawline when you are actually doing this kind of a liposuction. So this is called as a submental liposuction. So what I'm going to be doing is marking the lower border of the mandible here. My extension, what I'm going to be doing, I'm going to extend my this thing, and then what I'm going to do, put a small incision there, and then you put a lot of tumescent solution there. So you have to push on a lot of tumescent solution there. Again, you can do it under local anesthesia, you can do it under sedation. It's very simple in office procedure, and the patient is very happy. And then what you do is, once you have put the tumescent solution, wait for 5 to 7 minutes, hang on for 5 to 7 minutes, and then you start using a liposuction. So what do you do? So all you require are 2 cannulas. One cannula for pushing the tumescence. So you take the tumescent in a 10 ml syringe and you keep on pushing. That's number 1 cannula. That should be about 10 centimeter of the length. Dr. Athriya is going to show you the set which you can use it. The second cannula which you are going to be using is a harvesting cannula. Now what you are going to be doing is, you're taking the harvesting cannula, putting it into the syringe, and then once you put it inside, you create a negative pressure by pulling the back part of the syringe. And then you put a stopper there. So once you put the stopper there, I don't know if I can. So it is creating a negative pressure there, and all you have to do is keep on doing the liposuction. क्या हो गया? Yeah? Okay?
Very nice. That is okay.
And you can do it all along the lower border. If somebody says this is not defined, you go do all along. You can add up with 2 incisions here, just kind of the angle ke paas. You can just make 2 couple of small entries from there, and you can do that, and you just close it up like that. All right?
Yes.
Okay. कितना टाइम मैम?
हो गया. What is left?
बहुत सारा था, छोड़ो जाने.
What else is left?
थोड़ा V shape बनाना था वो सब.
Bana.
हाँ?
Bana ko? Go on.
वो बोल रहे 16 मिनट बाकी है.
Cut the last one hour. No, that instruments and all we won't do. So go ahead.
क्या हो?
कुछ नहीं करो.
Okay, now the patients come to you. They want to have a V-shaped jawline. What do you mean by V-shaped jawline? ये पूरा ऐसा free flow होना चाहिए. It should be. It should be V. How do you create a V? जो बोलेगा how do you create a V? I will give you a chocolate. You combine 2-3. No. Botox नहीं है. Surgery में आ गए maxillofacial surgeons. So first thing is you have to take care of the gonial angle. It's number one. Number two is sometimes all along the gonial angle, maybe you have to shave a little bit of the lower border, and then when you come to the front, all you have to do is put a simple chin implant and make it V. So it becomes. Alright? You are going to make a Y there. अभी कोई सब सो रहे हैं, मैं तो इसीलिए पूछा. अभी मैं पूछा इसके लिए Y बनाना है, V बनाना है. हाँ, so okay, so you give anesthesia. Okay, ma'am, मैं रोक लेता हूँ. And then a similar kind of a incision which we spoke in the morning. You expose the whole ramus, and then what you do is you take a burr and then you shave off the lateral part of the ramus, and then you take a piezo and you start cutting it. So now there are different ways how do you know that how much of a gonial angle you have to cut. So there are certain tricks which she is not going to allow me to talk on. Somebody wants to know, I can just always tell that later. But all you have to do is take a piezo, so that right angle piezo, just cut it off and hammer it off and it comes out. So once you have done it, this is what I have taken out, and then you close it. Same thing you do on the front, the other side, and you just shape it up, and then chin implant is all I have already shown you. So these are the procedures. Ma'am, एक दो procedure और है, बाद में दिखाऊंगा कभी सुन के मेरा ऑलिव पकड़ना था, जाने दो भाई. It's okay. Let them. Yeah.
Atif and Atreya, come. Thank you.